Hello, I'm Polly Conley. I'm the Chief Medical Officer of Western Sierra Medical Clinic, and even more importantly, a member of Grass Valley Rotary. And today I'm here with Jesse Wilson, our District Attorney and our Grass Valley Rotary President currently this year. Correct, Jesse?
That is correct. That is correct. I think until the end of June.
Yeah, and we're here today to talk about a project that both of us feel very passionately about and has been an important part of our work in the last several years, and that's the new Nevada County Family Justice Center, which just had its grand opening on Searles. And Jesse, do you want to tell us a little bit about how that came about?
Sure. And I'll do my best to explain how it came about. I'll probably defer to you a little bit because you were certainly an intricate part of how it came about. But best of my recollection, when I first became district attorney, one of the commitments was to strengthen our ability to elevate our level of services to victims at large.
Mm-hmm.
You in the public health sector, you certainly deal with public service and helping people in the community. So our interests aligned in that respect. And the best of my recollection, you and I were having dinner, I don't know, 2-3 years ago at some function that we were at, and we began discussing our mutual interest with serving the community and serving victims in the community, and some of those, whether it be from the public side of things and sexual assault victims, whether it be victims of criminal activity, that sort of thing. And I think that discussion started at that Christmas dinner way back when, and then fast forward to, again, 2 or 3 years later, and we had the soft opening and the grand opening, and it's hard to track really in chronological order because as things in bureaucracy work, sometimes it moves very slow, sometimes it moves very fast, but nevertheless, here we are, and as you mentioned, we had that wonderful grand opening, and it was the result of a lot of hard work by people in both of our departments as well as others that were involved in this. So it's been a very exciting, and all of a sudden here it is, and to make that happen in a relatively short amount of time was very exciting.
Yeah, I think for me, I've been talking about this for 4 or 5 years and had kind of given up on it a little bit until that dinner where we were talking. And I thought, well, I haven't talked to him about this yet. Mm-hmm. And, from my perspective, coming from a medical background, I would see children who were victims of child abuse, or women or men who were victims of domestic violence or rape victims. And you hear from the patients when they're sitting in my office what they go through. And I just kept thinking, there's got to be a better way to do this. The way we're doing it isn't as good as we could be. And so I was thrilled at that meeting or dinner where we were able to have this conversation and find this shared value and really move forward. And you're right. Like so many things in bureaucracy, it's like forever. Oh, wait, we have to be open in 2 weeks.
Right. Yes.
Oh, wait, there's a deadline that's right now. And so I'm thrilled that we were able to make this work, and I'm thrilled that we were able to work together to do this.
Yes, and it's just interesting because in that initial conversation, we didn't even know really what we were talking about. We knew there was a need there. With the labels we were putting on it and how that was going to be effectuated, we didn't have much of an idea. So when I say 2 to 3 years, that sounds like a long time, but really from identifying a need, but not really having a clear vision, to say the least, to an actual up and running family justice center that is a starting ground for even improved services in the community, and finding a way to from people from public service, we know how limited resources are and how outside the box you have to think oftentimes in order to stand something like this up. And it's not just as a matter of going to our respective departments and ask them for money. You need to find ways to do that. So it is, from where it began to where it is now, it is very, very encouraging.
It is.
And impressive.
Yeah. I would like to, that first night, you're right. Neither of us, I think at that point, if you had said Family Justice Center, we wouldn't even would know what that was exactly. I definitely was thinking, because I work in pediatrics, so I was thinking of a child advocacy center, but also in my head going like, well, it doesn't make sense to improve services for children and not their families. Like that didn't make sense. And that so we had dinner at Christmas time-ish, and then there was a conference in January, and my boss, who has worked with advocacy centers in the past, said, you should go to this conference. And I appreciate you a lot because I wasn't getting much feedback from law enforcement, but when you said, hey, there's this conference Western Sierra will pay for you to go. Could you send somebody? Then they listened a little more.
Sure,
So that helped. We needed both of us there. And that first conference, there was, I think, 4 of us who attended, and not very many. Somebody from your office, Lydia, who's a wonderful attorney in the district attorney's office, who's really passionate about this. Myself, a nonprofit person that I knew that's very involved in youth services, and a Grass Valley police officer. And this kind of like tiny band saw the vision, and we really got this like, oh wait, we can do this. This is doable.
Yep. And that's my recollection as well. I mean, you guys came back with that, which with a much more focused vision and a ton of energy, and not only just the energy, but actually the tools and the motivation to make it happen. So I think shortly after that, there was collaborative meetings that were taking place. At somewhere along the line, we were lucky enough to get Stephanie Fisher as an executive director who was already operating in that space, and things started happening very quickly from there. And on a point that I mentioned earlier, that it took so many people to bring this forward, that also is kind of indicative of Nevada County as well. I mean, this is something that I don't know in other jurisdictions, if we're able to stand this up and offer this level of service in a community in this amount of time, but for being in Nevada County and having the law enforcement buy-in, having obviously public health as a partner, having the DA's office, I mean, the county services and a lot of nonprofits. It was very, very much of a Nevada County end result in that respect.
Yeah. And I think once we had the vision and we could share the vision of how this could work, it really took off. And that was the time that we started to see things really change. So I am really grateful for you that we got to sit next to each other by accident at that dinner, that we could have this conversation that led to this wonderful place. We're going to now be going to commercial, but stay, because the next guest is Stephanie Fisher, who you mentioned, who is the executive director. And she and I are going to talk about the dreams and plans for the future for the Family Justice Center.
In the heart of Nevada County, the Rotary Club of Grass Valley is making a difference, one project, one person at a time. Rotary believes in the power of service and is dedicated to improving the community through hands-on projects, educational initiatives, and global outreach. Join an organization that creates positive change, whether you're giving your time, your talents, or your heart. Together, they make our community a better place for all. Rotary Club of Grass Valley, people of action. Become part of something bigger today. Visit rotarygv.org for details.
Welcome back. Thank you for staying with us. I'm Polly Conley, the Chief Medical Officer at Western Sierra Medical Clinic and a member of the Grass Valley Rotary. And I'm here now with Stephanie Fisher, who's also a member of Grass Valley Rotary. And Stephanie, I think some of our first conversations started at Rotary meetings. Is that right?
Yep, you pulled me in just like you pulled in Jesse. It was at a casino night, one of the fundraiser nights that we do for Grass Valley Rotary. And it was still when I was working at Community Beyond Violence. So I was there for several years. And you said, we have this great idea. And it was after you guys went to the first conference.
Okay.
And I was like, I want to be a part of it. How can I help? And, been on board ever since.
Yeah. And I remembered you weren't at the first conference, because I was trying to think of that the other day as I was recollecting how this developed. So we attended that first conference with a small band of people wanting to learn. And really what speaks to, I think, Nevada County is a year later, just 1 year, this kind of difficult to get program and sometimes hard to help people understand. We went to a similar conference, and I can't remember, did we have like 15 people attend from our county?
Yeah, I think there was 14 people that went.
Yeah.
Because Lydia had written a grant through the district attorney's office, and we specifically wrote in their funding to be able to pay for some people to go, to bring this cohort to go to help, build this momentum. So we paid for some people, and then a lot of agencies paid for their own people to go. And we brought this massive group of people to this Family Justice Center conference that we got a lot of compliments about how we were utilizing the conference to help build the momentum for the vision.
Yeah. And I think it was a really successful to me, that was kind of one of those turning points where I felt like before that, we're talking a lot about this. How much momentum are we getting? Do we have enough buy-in?
Mm-hmm.
And then when I showed up at the conference and saw so many people there, I thought, oh, it's not just me.
Yeah. No,
There's lots of people who care.
it was really wonderful. Rachel Pena went and Sarah Perry, and
Yeah.
so we had Grass Valley Police Department and
Nevada County Sheriff's
Social
Department was there,
Service.
Nicole.
Yeah. Yep. Nicole Hamilton
Yeah.
and Nevada City Police Department and you and Community Beyond Violence and District Victim Witness Advocates, and I mean there was a whole bunch of
Public
people.
Health
It was a lot of
Department
fun. Mm-hmm.
It was, anyways, at least Rachel Pena was there.
Mm-hmm.
It was just really a lot of fun. We had a lot of fun, but also it was one of those turning moments for me where I felt like, oh, we're going to be able to make this happen.
Yeah, and it was really great because all of those people that were at the conference then ended up turning into our planning council.
Yeah.
So the way that we did with the Family Justice Center is it wasn't just going to be a district attorney's office program or Western Sierra Medical Clinic program. It was really meant to be a community collaboration. And without it being a nonprofit or that type of stuff, we just had this kind of this informal group of people meeting on a monthly basis to talk about what a Family Justice Center would look like here in our town and what we needed it to do in the future in order to meet the needs. And it was great because everybody contributed, staff and money and space.
Yeah. And I think too, another turning point for me was when we were at that conference in San Diego, you see the big, beautiful conference or Family Justice Center they have. And it's kind of like, oh, well, we're not going to have, we're a little Nevada County. There's no room or money for that.
Yeah.
But really it was going to visit other family justice centers who had started on a shoestring, who had maybe one borrowed room, that I think really helped the rest of the team see oh, if Susanville can do it, we can do it.
Yeah, that was really great because I think I was still at Community Beyond Violence when we went to go visit Lassen County. So we saw the Lassen County Justice Center and then San Joaquin County and Sacramento. And obviously we knew what San Diego looked like. So it was really great to see we could still do the work no matter what type of resources we had, as long as we had the collaboration.
As long as we were working as a team.
Yeah, working as a team and all moving towards the same vision of providing a better integrated response to violence. And that we definitely had that. It propelled the program to initiate, I think, quicker than it would have otherwise.
Yeah. And I think it helped. I kept trying to make the point in these meetings, we're not asking you to do more or different work. We're just asking to do it in a different way.
Right.
We're doing the same work you've already been doing, whether your job is law enforcement or your job is medical or your job is public health. You're still providing those services just in a better way for patients. So would you explain what a Family Justice Center is and why we care about it so much?
Yeah. So when we were still talking, we had already decided that we were going to do a Family Justice Center. I went to the Interpersonal Violence Response Group, that quarterly meeting, and we did a brainstorming session. If somebody was a victim of violence in Nevada County, what are all the different entities that they might have to engage with or interact with in the county? And we came up with at least 52 different agencies: counseling and therapy and housing and medical provision and law enforcement and the courts and all of these different agencies that somebody might have to go to and tell their story again and again, do an intake again and again, make these phone calls, maybe take time off of work, maybe they're struggling with childcare. We were seeing that is how people fall through the cracks when we're trying to keep them engaged in supportive services, is that it was just really hard to access all those services. And so the Family Justice Center brings them all to one spot. So one physical location where we've got a centralized intake. We have information sharing protocols, and the staff members who are there from all of these essential agencies are all trained in trauma-informed care and specialized in domestic violence and sexual assault and the different types of victimizations that might walk through the door, so that they're working with friendly people from our professional service providers. And they can just stay in one room and tell their story one time, and then they get to choose who they want to interact with. And then I send our partners in to go provide the services that they would normally provide from their own location. We just do it from one physical location, and it just makes the process so much easier for somebody who has to engage in multiple different types of services throughout the county. They don't have to worry about telling the story over again and giving the same information over and over again. So it helps make the services that we already have in our community just more accessible for people.
Yeah, I think that's a really key point, is that we're trying to make this as seamless an experience for a victim as possible, and really victims of all crimes. So, I mean, because of our backgrounds, I primarily think of child abuse. I think you probably primarily think of domestic violence because that's the areas we come from. But it's really also, victims of elder abuse. It's, it's victims of any kind of violent crime or any crime, really. And so this is a service available to all members of our county.
Yeah, I think one of the beautiful things about the Family Justice Center is it's twofold. There's one side where we want to provide better services for victims. And then the other side is that our service providers, when we did all of our strategic planning and our stakeholder engagement prior to starting the Family Justice Center, we were talking with our service providers. We want to make their jobs easier too. And one of the things we were hearing from everybody across the county is everybody's short-staffed. They don't have enough money. They're all working, beyond their scope. They're trying to help people do, and they're doing things beyond what it is their actual job is. And we've got major issues and challenges in our county with transportation and housing and mental health challenges and things like that all of our service providers are struggling with how to address within their own means. And so the Family Justice Center doesn't just help integrate a better response for victims of violence, but it also can help our service providers and so that they can just focus on the job that they're meant to do, and we can take care of the rest, or we can seamlessly connect our victims to the other services that are in our community. And then we're also, because it's a community collaboration, this is one of the things I really get excited about, is we're able to help address bigger systemic challenges within our community. Medical forensic exams that are not currently happening in our community. We were talking about implementing a strangulation protocol and developing a domestic violence high-risk response team. And so all of those things take entire community support to be able to implement in our community. And the Family Justice Center kind of just sits right in the middle of all of that to be able to help facilitate it. So.
Yeah. I think one of the exciting pieces of news we've gotten even since our grand opening is that we did receive one of our federal grants. Do you want to tell us about how that's going to help us do more? You and I have big dreams for the future. And so this is going to help start some of those dreams.
Yeah, absolutely. So we, since I started working on starting a Family Justice Center last January 2025, been doing a lot of grants, grant writing. We had a federal grant and a state grant that we received. And then just recently, we received notice that we've been awarded $700,000 over the next 3 years, more federal funds. And a big portion of that funding is going to go towards a partnership with Community Beyond Violence on Site, but also Western Sierra Medical Clinic, so that we could create a training program to bring forensic medical exams to our county. Because right now, when somebody has to go get a rape kit done, a lot of people know what a rape kit is. They've got to go out of county to do it. And so that creates barriers, obviously. And so being able to create that program here in our county is really exciting. So happy to be able to be a part of bringing that to our county through the Family Justice Center.
It's definitely been a passion project of mine, and one I'm really proud of the work of. And we will go to commercial right now and come right back. There was one more thing I wanted to say. So can I come back and say one more little thing? Yes. Okay.
Hello, I'm Ed Pinto, a proud member of the Rotary Club of Grass Valley. The motto for Rotary, as you might know, is service above self. What that means is that many women and men who want to give back to their community join a Rotary.
Thank you so much for, Thank you so much for joining us. We're just in our last closing section with me and Polly Conley from Western Sierra Medical Clinic and Stephanie Fisher from the Family Justice Center. I know I've shared this with you before, Stephanie, but I have one day in particular that weighs heavy on my mind. And I think about two siblings who, from 7 a.m, when they were first taken in by law enforcement, and then they came to me to see if they were medically stable. And then, they went to law enforcement and had an interview. And then that interview made it clear that we needed a more in-depth exam. And that was a drive down to the Sacramento, to the Bear Center, where they can do those child exams. And then by the time all of that happened and they had gotten into foster care and done all the things, these poor little toddlers had been in like 6 different buildings over 14 different hours. And it just made clear to me how desperately we need better services in our county. And so working on this project together, I just keep thinking about those 2 siblings and how much better it would be for them to come to one place.
Yeah.
Everyone come and see them there, and they get those services all as simply as possible with as little stress as possible for them. I do want to make clear that it has justice in the name. It is organized through the district attorney's office. But would you talk about whether or not using these services make it so that you have to press charges or be involved in the justice system?
Right, absolutely. That's a good question and a good thing to clarify. We're called the Family Justice Center of Nevada County because we are following a proven national, actually it's an international framework of a family justice center model. So there's all of these outcomes and published research that's done on the outcomes, the great outcomes of family justice centers. And so we are following this framework. We're creating something. We're not recreating the wheel, essentially. We're building off of what other people and other agencies have already done that work really well. So we have the name of the Family Justice Center, but it doesn't mean that somebody has to be involved in the justice system in order to receive services. So even though I work for the district attorney's office, somebody can come seek services through the Family Justice Center. They don't have to be working with law enforcement. They don't have to be working with the district attorney's office. They can receive safe services there, and they get to choose what services they want to engage with. They don't have to talk with any agencies that they don't want to. And it doesn't necessarily have to be a family in the sense that we know it. People can come and receive services whether or not they have kids or whether or not they're married or whatever those services are. If somebody's a victim of domestic violence, sexual assault, child abuse, elder abuse, human trafficking, stalking, those types of interpersonal violences, they can all receive services at the Family Justice Center in the way that feels good to them.
I think that's a really key point, is that we really are there to be an advocate for that person and help them get the services they need the way they want them and speak for them. So thank you for sharing that.
Yeah, absolutely.
And thank you all for joining us. And really, I'm grateful that Grass Valley Rotary made it so I had a chance to meet Jesse and a chance to meet you and have this dream come true.
Yeah, absolutely.